I'm Judy Richards, and I'd like to welcome Jack S., Republican candidate for House District 21. Thank you for being here today, Jack.
It's my pleasure.
Tell us about your positions and your experience that would encourage a senior or a person with disabilities to vote for you.
I've been active in politics for a number of years, and I started over in Eastern Oregon when I was away from the Capitol, but since then I have moved to the Capitol. I've worked closely with Oregon Citizens Lobby. I chaired the Healthcare Committee, which is important to most all of us seniors. Today, the major thing with the coronavirus is addressing the seniors, as seniors, like myself, are deemed more susceptible to the virus, especially those with pre-existing conditions. And that is where I feel that the need needs to be addressed. And this happened when the virus first came out, and the seniors being protected in nursing homes, senior living areas, and private homes, we would have had a lot less deaths in the senior community and a lot less action within the coronavirus. And I think if I can be elected, I have 40 years of experience in healthcare management, and I believe that I can add some knowledge to our legislature in these areas.
Thank you. Oregon Project Independence is a cost-effective program that keeps seniors and people with disabilities in their own home. And yet every year proposed funding for OPI is significantly cut. If elected, what will you do to protect funding for OPI?
The home is the best place to keep individuals if they have proper care. As I said, I worked 40 years in healthcare. Some of that was with nursing homes attached to acute care facilities. I observed in that situation that the individuals that didn't have the care at home and were placed in nursing homes, I'm going to say nursing homes specifically, did not receive the emotional and family support needed for good health. Therefore, it would be my goal to direct funds more directly to in-home care than in care facilities, either nursing homes or senior care centers.
How would you prioritize state funding, including funding that is matched with federal funds such as Medicaid for services to an increasing senior and people with disabilities population?
That's a good question. How this money is distributed has got to be looked at seriously. I've got a little knowledge in healthcare. The seniors and the disabled are the highest risk population here, i.e., I'm saying that over single parents, male or female, and we need to look more directly at protecting our seniors. Again, I'll go back to COVID-19. Our state did not, nor did the nation, address the care of seniors and disabled people appropriately at the start of this epidemic. I think it is the legislature's responsibility to see these things and address them to protect those people to the highest level we can.
Thank you. During this time of increased risk of homelessness and food insecurities, what will you do on a state level so that seniors and people with disabilities no longer lack or face a lack of accessible, affordable housing and receive appropriate nutrition?
The homeless is a major problem we have right now. This has transpired greatly, I believe, by the action of the states over the last 10 years, closing mental health facilities around the state. Many of these people, not all, but many of these people want help, but they have no place to go to get this help. And therefore, they're sitting floundering on our streets. I know of personal instances where young men, middle-aged men, who had been drug addicted and recovered, and then, through total fault of their own, dropped back into it. They wanted out, they couldn't get out. Therefore, they were sitting homeless. I know of one that finally got into a program in Portland, whether this is young, middle-aged, or aged, that need help off of the streets and to get their life together. They need a program within the mental health division of the state. We have cut that back so far that these individuals are floundering. The one case I was referring to was lucky and got into a case in a program in Portland, and for the last 2 years has been a security guard for Intel and is doing well. We need the state to address the mental health of our community to bring these people out of the problem they're in, those that want out. Those that don't want out, you tell me a way to work with that and I'll be happy to listen.
Thank you. What are your plans to improve the health of vulnerable seniors and people with disabilities, including people of color who traditionally suffer from more health disparities due to pre-existing conditions?
Helping people of senior classification, I don't care whether they're white, green, blue, yellow, red, are all equal to me. People are people created by God. Now, what would we do? Let's go back into the mental health as a major area that we can help these people. Other than that, giving care, in-home care, is very important to me. I strongly believe, after my 40 years in healthcare, that keeping people out of medical facilities is one of the best treatments available to our public.
Thank you. Thank you once again. This is Jack Esp, who is interviewing for the Republican candidate for House District 21. I want to thank you for joining us today for this interview with Jack, and I hope that you have enjoyed this as we have enjoyed meeting with Mr. Esp. Thank you again.
Appreciate the time you provided me and my ability to address the concerns you are facing daily. Thank you.
It's our pleasure. Thank you very much.